Hi, my name is Abdul Razak. I am a performance specialist and an auditor. Today we are going to talk about history of present illness. History of present illness is a description of development of patients presenting illness. A history of present illness is a patient's version of the events that led to his or her visit to the clinic. Today we are going to talk about history of present illness. We are going to discuss a scribe's responsibility when it comes to documenting history of present illness. When a patient is seen by a clinician, they both discuss a patient's symptoms and presenting problems. A scribe is responsible for documenting these details. These details can be either relevant or irrelevant. For example, when a patient sees a doctor, they can talk about their presenting problems. Let us take an example. The patient is seen today for chest pain, and when the details of chest pain are discussed, the scribe must listen to these details and document all the information that is relevant to chest pain. It is not necessary that the patient and the doctor would only talk about chest pain. They might talk about something else. For example, they might talk about some football game or some movies which might not be relevant to the patient's presenting complaint. This is called irrelevant information. A scribe should document a patient's presenting complaint in chronological order. When the patient and the doctor are talking about their presenting complaint, be very careful and listen to the doctor's questions. Let us take an example. The patient is presenting with chest pain. So the doctor would ask the patient a number of questions like when the chest pain began, what are the symptoms of chest pain, how bad or how severe is the chest pain, and with the chest pain if there are any other symptoms, what the patient took for the chest pain, if he or she took any medication, and if the medication was helpful or not. So these are the questions that a provider or a doctor might ask a patient, and a scribe should be listening to these questions very carefully and documenting all this information in a chronological manner. It should be written in a clear language that is easy to understand and without any grammatical errors. The scribe would document the patient's chest pain symptoms as follows. Taking the example of chest pain, let us assume the patient is a 30-year-old male. So the HPI would read as follows. The patient is a 30-year-old male presenting to the office with a chief complaint of chest pain. The chest pain began 2 days ago, which the patient noted upon waking up. The chest pain was described as mild, not associated with any other symptoms. The patient did not take any medication but presents today because the chest pain has been worsening. He wants to get himself evaluated. So this is how a history of present illness can be documented by a scribe. Moving forward, history of present illness can have single complaint or multiple complaints. Single complaint like what we discussed before, chest pain, and multiple complaints can be many complaints, 3 complaints, 4 complaints. For example, chest pain, headache, hypertension, that is elevated blood pressure, etc. In the upcoming videos, we are going to talk more about history of present illness. We are going to talk about elements of history of present illness. There are 8 elements in history of present illness, which we will discuss in the upcoming videos. If you like the content of my videos, please subscribe to my channel and share my video with your friends. If you have any doubts or questions, please write down your questions in the comment section below, and I will answer your questions. Until my next video, take care. Bye.